This segment is sponsored by Smile Dental Partners, a locally owned multi-specialty dental practice in 4 locations around West Michigan. Each practice offers adult and teen dentistry on one side, which is called Smiles, and pediatric dentistry on the other, called Little Smiles. Dr. Darren Riopelle joins us now to talk about keeping those little smiles healthy, and it's good to see you again, Dr. Riopelle.
Thank you. Thank you for having me again.
Well, we talk about the practice being multi-specialty and that you've got this Little Smiles aspect. Tell me a little bit about that.
Yeah, Little Smiles was born almost 8 years ago out of the feeling of like kids deserve something different, right? Because you bring a little child in and you put him in this large size chair, they're scared enough. And I said, there's got to be a better way. And it really stemmed from looking at adults that I would have in their older age. And they had these biggest fears when they were little. I'm like, wait a minute. If we can develop a really good experience right from the very start and then monitor and make sure it goes all the way through the end, it's a great thing. So I wanted to, instead of solve the problem at the end of the adult, I want to go back to the very beginning so they never had it in the first place. So that's where it was born from. And then we just really asked kids in our community, said, what does it look like to you? We literally sat down at every elementary school and preschool and said, what would be fun for you? And we actually took the kids' ideas and incorporated into a separate office. That's where it was born.
And the fun really hits them the moment they walk in the door. I can't imagine saying going to the dentist and being fun, but you really have made it that kind of an experience for kids.
We have. It's great. So when they walk in, the kids there's nothing scary. We have big trees, we have games. Fewer games now, of course, with the current situation, yeah. But it really is a dedicated space just for them. And it makes the parents happy too, because at least on the adult side, when they walk in, they're not a bunch of kids. We actually kind of separate them. So on both sides, it works really well. But it's really neat having the kids and the parents all in one environment, because it's the easy button, right? You don't have to have new forms every time you go back and forth. And I can tell you that kids want to run into our office. They get upset when they leave, and a lot of our parents won't tell their children they have dental appointments because they're going to want to go.
And is it ideal that a parent makes his or her appointment on one side of the building and the kids are at the other, and do it all at once? Is that what you like to do?
We do that, yes. It depends on the age of the child. Sometimes the child's young, you want the parent to be around, but certainly at a certain age they do. And what we really like about it is that, we know that at that point we can take the child from the very young ages all the way up. And we know that when they transfer to the next level, their continuity of care is there.
When you talk pediatric dentistry, does that mean that you have a pediatric dentist who does that?
Yeah, so the definition of multi-special us is we do what we do best. And we have pediatrically trained dentists on our team all day long. So every single child in our practice sees someone who that's all they do. That's their language. When you meet a pediatric dentist, they are born to have that gift to communicate with children and parents in a whole different way that, it's hard for me to go to a 3-year-old and off to a 50-year-old to talk 2 totally different things.
Yeah.
And it's specialized, and the response is great. The kids are happy, the parents are happy, and just better quality service.
Yeah, tell me a little bit more about, we talk about, it hits them the moment they walk in the door, but then also when they're sitting in the chair, the approach to that child. Talk a little bit more about how that's different.
So the whole team on all sides are trained, but the pediatric team is trained even more. Just the way you approach a child, there's certain words you don't use. Like we coach the parents, the words you don't say. You don't say shot. I mean, there are some things that we can really work with, but it's really an overall environment of taking the time with the child and listening to them, listening to the parent, and give them the environment where it's not a bunch of stuff around. It is really a calm, warm environment.
I hear there's a big treasure box at the end too, which is exciting. But at what age do you like to see your pediatric patients to get started?
As early as 6 months. And I say that before they don't have teeth. We have many instances where there's some newborns who aren't breastfeeding very well or have latch issues or lip issues. So we see them as early as newborns all the way until about 12. And around age 12, they get old enough where they want to mature up a little bit. And then we'll shift them over to more of the adult side.
All right. Well, it is terrific. Once again, Smile Dental Partners, 4 locations in West Michigan, including Grand Rapids, Holland, Grand Haven, and North Muskegon. You can find a link to their website on ours, 13onyourside.com. Dr. Riopelle, thanks so much.
Thank you.